Hey guys, welcome back to the channel. So in today's video, I want to take you guys through one really simple deep breathing exercise, a really highly effective deep breathing exercise for anyone wanting to better manage your stress, to help you conquer your pain, and to help optimize your sleep. And I know they're big statements, and often it seems like those three ideas aren't necessarily connected, but there's an underlying principle that binds those things together, which we'll get to in a second, of which deep breathing can have a really impactful influence over in a short amount of time for a lot of people. So how we'll go about this in the video is we'll get to the exercise towards the end, but in the middle, I want to provide you guys some context. I want to talk about, I guess, why we need to do an exercise, a deep breathing exercise for sleep, stress, and pain. And I want to tie in how it's effective, because I want to make sure that by the end of this video, not only do you have this really simple breathing exercise to take with you, but you've got the tools and the context to understand not only why it's important, but how powerful it can be and how you can use it in your everyday life to optimize other things if you want to. So please watch the video through the end, just so that you have the full story to take home with you. But in the meantime, before we get into it, if you do go on to like the video, if you enjoyed the video, please consider leaving a like below. And if you are new to the channel, I'd really appreciate it if you would consider subscribing. If you like learning about sort of the ways to optimize the body, to help treat your own injuries, maybe some concepts, or with some concepts that maybe you're not necessarily aware of, we'll sort of always bring out new information and things that we're finding clinically as physical therapists to really help you solve the things that you're struggling with at the moment. So if you want to learn more about those things and you want to jump on board with us, please consider subscribing if you are new, like I said. But on top of that, please let me know in the comments what you guys are dealing with. If you're dealing with some knee pain, some back pain, if you've got a problem that you've seen, 15 therapists and specialists and doctors and all these sort of fancy people for, and you haven't got answers yet, you are definitely the people that I want to hear from. Or even if you're someone who's got a run-of-the-mill issue that you just haven't quite found the right thing that helps you yet, let me know, because I want to make sure that we're providing content that is hopefully insightful and interesting, but really helpful, and hopefully the missing piece to some of the issues that you guys are dealing with. So let us know in the comments below what you guys are going through. So back to the video. So the deep breathing exercise that we want to talk about is an exercise called box breathing. And I'm sure many people have heard about this before. Again, it's a really simple exercise that we'll get to in a second. But the reason why it's an important exercise is the effect that it can have on your nervous system, and in a very short amount of time for a lot of people. So to provide the context that I think you need in order to do the exercise properly, but also to do it in the right context, particularly when we're talking about optimizing sleep, pain, and stress, is we need to understand the difference between, I guess, a normal nervous system and a heightened nervous system. And when we talk about a heightened nervous system, we're really talking about, in essence, that fight or flight response. So if you were walking around a corner and I jumped out and scared you, and you feel that sudden rush of blood or that rush of adrenaline, which the body uses as a way to fight or flee. So again, it's an innate, a program response that we have, where your body tries to give us this short boost of superhuman capacity to either fight a threat head on or to get you out of there safely. Both of those ideas are there to help you survive that moment and to get through to the next day. But in today's modern world, where a lot of threats aren't necessarily fleeting anymore, so in the wild, if you are attacked, you either get out of that alive or you don't. Either way, that moment passes relatively quickly. But in the modern world, most of our threats and our stresses are chronic stress, whether it's financial stress, it can be cultural stress, religious stress, it can be relationship stress, work stress, time stress, financial stress, but I didn't say that one. There's all these things that cause us stress and heighten our nervous system that don't go away easily. If you're in an abusive relationship, if you're working a job you don't enjoy, if you're someone who works a job where you're constantly under time constraints, even if you're just struggling financially, which I know a lot of people do, that stress doesn't go away in an instant. It's often there for a long time, and the presence of that constant stressor can leave the nervous system in this constantly heightened, fight or flight response. Maybe not at the peak of what would happen if you were suddenly scared, but it's a lower, more sort of prolonged version of that. So If you get a spike when you're in a fight or scared here, and this is that sort of normal, safe, happy baseline, you might find that your body is consistently somewhere in between. But the point I wanted to make here is that regardless of whereabouts it is, it's rare to find too many people who are at their baseline, where they're just consistently de-stressed and de-heightened in that nervous system, and they're not getting any of the consequences that we often see. Now, the reason why talking about a heightened nervous system is important is that if your nervous system is heightened, it's harder for you to deal with stress. Now, an example that we all know well and good, if you are running late for an appointment and you jump in the car, you're driving behind a slow-moving car, how often do you feel like that slow-moving car or the person in that car is the worst person in the world? You might throw some expletives their way. You might try and you might default into some road rage. You might start to drive a little bit more sort of irresponsibly to get around them and to get to where you need to be. Now, if we were to repeat that same experiment, but the next day you weren't stressed, so you had a good night's sleep, everything's going well, you're still running late, but you get into the car and you're feeling a lot better about things. If you're stuck behind the same slow-moving car, even if you left 5 minutes earlier, that car doesn't, I guess, disturb you as much emotionally and physically as it does when you're already stressed. So if you're already stressed, that nervous system is more heightened, your capacity to then deal with extra stress on top of that is reduced. Again, we all know someone who snaps or is short-tempered, someone who's quick to anger. It's not necessarily a personality fault that they have in a lot of cases, it's that their nervous system's constantly heightened as a default, so they don't have that buffer or that tolerance to handle added stress or more difficult things on top of that. Same thing with pain. What we know with pain is that pain isn't necessarily based on sort of the specifics of injured tissue, where there's damage or no damage. It's more based on your brain and nervous system's perception of threat. So if you're someone who has an acute injury, say you damage a calf muscle or a hamstring, or you injure a back, clearly your brain is good and your nervous system will feel threatened and heightened and generate pain in that moment. But if you're someone who has chronic pain, for example, a lot of what chronic pain isn't so much that there's this physical dysfunction that's not healing and going away, but it's the chronicity of that heightening of your nervous system, that constant heightening where your brain is constantly being told that there's a threat somewhere. And if you've got a painful area that someone might have a 2 out of a 10, you might find that your pain's a 10 out of a 10 because there's all this other sort of physiology or this dysfunctional physiology on top of that. And in terms of getting pain to go away, we need that nervous system to feel safer, to feel less threatened, to allow that pain to disappear. Because remember, pain is a protective mechanism. So your body's telling you that it constantly needs protection because of that heightened threat perception that your nervous system is generating. So in terms of stress and pain, they're intrinsically linked because of the consequences of a heightened nervous system. And the same thing happens with sleep. Now, if you can imagine that in order to fall asleep, your body has to sort of regress to a point where it feels safe enough and relaxed enough to tick over into that sleep state. And if that nervous system's constantly heightened, constantly on edge, constantly threatened, it's very hard for you to get down into that required area in order to sort of fall asleep and stay asleep. So people who have insomnia, people who find it really hard to fall asleep, how often do you find that, say you're about to fall asleep and then maybe something startles you or someone comes into the room or maybe your phone rings or something, and you then find it hard to regress back again to that same state quickly. And again, a lot of the time it's because that nervous system has become more heightened than it was before, so it's going to take time for that to drop back down again. So again, those three concepts of stress, pain, and sleep are really integrated within a heightening of a nervous system, or the state that your nervous system is in is really important in terms of allowing certain things to happen, in terms of you feeling less stressed, in terms of you feeling less pain, and you sleeping better. So when we go through this box breathing technique now, it's really important that you have this goal in mind of not just doing the exercise for the sake of doing it. We're not doing it for repetitions or for a certain number. We're trying to do it so that you feel like you've achieved a more relaxed physiological state. So what I always suggest everyone does is to close your eyes and just take do a report of how you feel. Do you feel stressed? Do you feel on edge? Do you feel relaxed? Or is it hard for you to decipher what you're actually feeling? Either way, just take a mental snapshot of how you feel in this moment before we get to the exercise. Because once we've done it, we'll only do maybe 2 or 3 cycles, but I'll get you to close your eyes again at the end. You need to compare those 2 states, how you feel at the end versus how you feel now, so that you can actually see what's happened. Because if you don't feel like your nervous system's dropped down a few gears or 2, it hasn't changed. But we need you to keep doing the exercise until you genuinely feel like it regresses to a more safer, relaxed state. And from that more relaxed state, you'll find that you'll manage stress better, you'll tolerate stressful situations better. If you have some short-term acute pain, that pain will start to go away faster. If you have chronic pain, you'll be able to find that you can start to turn the dials down slowly on the amount of pain that you have. Yes, it will take a little bit longer. It might take a few days, a few weeks, a few months to get that pain to drop down. But as that chronically heightened nervous system starts to become less heightened over time, you deserve to start to see some benefits and some changes in those areas. And same thing with sleep. If you're finding that you get into bed and you just can't fall asleep, do this exercise in order to get you to dump down a level or 2. I can guarantee you'll find it easy to fall asleep, possibly stay asleep, and even have a better night's sleep because of this one simple exercise. So let's get into it. So in terms of box breathing, the reason why we call it box breathing is because I want you to visualize a box. So essentially, we're going to do a breathing pattern that revolves around choosing a certain number. We're going to breathe in for a certain number. We're going to hold it at the top. So you're going to hold your breath for a certain number. You're going to breathe out for a certain number, and then you're going to pause at the bottom for a certain number. So you're going to pause at the bottom with no breath in your lungs for a certain number, and we're going to go around in a square or a box until you feel like things drop down a gear. Now, for most people, the number will change based on how heightened you feel, how much tolerance you have for carbon dioxide, how used to these techniques you are. But for a lot of people, starting at about 5 seconds is a really useful beginning point. So please feel free to do this with me. If not, please do it once you finish watching this. So what I'm going to get you to do is we're going to breathe in for 5. We're going to pause at the top for 5. We're going to breathe out for a count of 5. And then we're going to pause at the bottom for a count of 5 before breathing in again and continuing that process. So basically, I'd always recommend getting comfortable, lie on your back, close your eyes, find a position that you feel very safe and relaxed in already, and then we'll do this deep breathing on top of that. So ideally we get you to breathe in through your nose, because that's more of a relationship to your sort of parasympathetic nervous system, the nervous system that down regulates these things. And mouth breathing or breathing in through your mouth is more of a consequence, or it's more related to the sympathetic nervous system, that sort of heightening of that nervous system. So I'll do it through my mouth, but I'll get you guys to do it through your nose, just to amplify the effects of the exercise. So basically the exercise is as follows. So you want to breathe in for a count of 5. And pause at the top for a count of 5. And breathe out for a count of 5. And then pause at the bottom for 5. And then we start again. Breathe in. Pause. Breathe out. Pause. Breathe in. Pause. Breathe out. Pause. Breathe in. So we keep going around in that pattern until you feel like things start to drop down a level. Now, in order to tweak this, if you feel like that you could breathe in for a little bit longer, so maybe a count of 6, a count of 7, do that. If you feel like 5 seconds is a real struggle, so say if you're someone who has maybe some breathing difficulties, maybe you have chronic pain, maybe your nervous system's really, really heightened, you might find 3 seconds might be a great place to start. But you'll find a really comfortable rhythm and a comfortable pattern where it's not too much of a struggle just to keep going through that box breathing. And I'd urge you guys to do it. Aim for 5 repetitions, then reassess how you feel. So close your eyes again. Just get a sense of whether you feel ever so slightly more relaxed than before or the same. Because as I said before, we need that to be your end goal in order to see change with this. So So just to recap on this, we want to make sure that we're influencing a heightened nervous system and sort of cueing it into down regulating so that you have better tolerance for stress, so that your body doesn't feel as threatened and can influence your pain response, and it will allow you to fall asleep and stay asleep better in terms of optimizing that sleep. So that's box breathing. As I said, it's a really simple exercise. It's not too fancy. It's literally just breathing in and out for a couple of minutes at a time, but it's really effective and really sort of fast acting in its ability to bring you down a level or two. So again, please give it a go. Let me know in the comments below how you find it. I challenge anyone to not feel like it's making a difference to how they feel overall. If you're finding that you are unable to feel like it gets from one point to the other, where you don't feel like it's down regulating, there's every chance you need to keep doing it. Just keep doing it for longer and longer. The more you do it, you'll find that the more responsive your nervous system will become. And then over time, you'll be able to maybe go through far less number of cycles before you can achieve that state. But hold me to it. It's a really powerful way to start controlling your physiology a little bit more and influencing things that are important to you. So with that being said, thanks for watching. Let me know how you're going in the comments below. Please consider leaving a like if you found it useful, and then subscribe to the channel if you're new for more of these sort of little tips and tricks that might be beneficial for you guys. But until next time, thanks for watching, and I'll talk to you soon.